Hello everyone. Today, I was reading this Preprosthetic Surgery chapter from OS. So I have prepared this chart in which the whole chapter, whole unit Preprosthetic Surgery, I have concised and put it into a chart form. So I hope it helps. So the three basic procedures, the main procedures we carry out under preprosthetic is alveolar ridge correction, alveolar ridge extension, and alveolar ridge augmentation. Let's see one by one. So in alveolar ridge correction, we have bony surgeries and soft tissue surgeries. So in bony surgeries, we do alveolectomy, alveoloplasty, which is important from exam point of view. We have two types, primary alveoloplasty and secondary alveoloplasty. In secondary, we have two procedures that are given, which is also important for exam: Dean's alveoloplasty and I don't know if I'm pronouncing it correctly, or Vigisser's procedure. Then we have removal of undercuts. How are we going to remove it? We'll trim the tori, mandibular and palatal tori, removal of genial tubercle, mylohyoid ridge, and maxillary tuberosities. These are all the bony procedures for alveolar ridge correction. Now, soft tissue procedures would be flabby tissue removal. Then we have granuloma or any hyperplasia, epulis, papillary hyperplasia, and splenectomy. Now, extension, alveolar ridge extension, is also called as vestibuloplasty. So, in that we have labial and lingual vestibuloplasty. So, in labial or buccal vestibuloplasty, we have submucosal vestibuloplasty, maxillary pocket inlay technique, lip switch technique, Kazanjian's technique, Godwin's technique, Clark's technique, and Obvigisser's technique. And in lingual vestibuloplasty, we have floor of mouth extension or lowering. So in floor of mouth extension or lowering of the floor of mouth, we have another three techniques. We have Trauner's technique, we have Caldwell's technique, and Obvigisser's technique. Then we have alveolar ridge augmentation, in which we put grafts, which are autogenous, allogenous, alloplastic graft. So in mandible, maxilla, augmentation plus orthognathic surgeries and distraction osteogenesis. So in mandibular, we have superior border of mandible technique, inferior border ke liye. Then we have interpositional or sandwich bone graft technique, visor osteotomy, onlay grafting, pedicled augmentation, and ridge split technique. In maxillary, we have onlay bone graft, interpositional sandwich bone graft technique, in which we have two procedures, sinus lift and ridge split technique. Now the third one is augmentation plus orthognathic surgery combination. So we have mandibular osteotomy, maxillary osteotomy, and combination of both. And the fourth one for augmentation is distraction osteogenesis. So in this whole page, I have concised the full chapter preprosthetic surgery. This is basically very useful for the last minute revisions.